Welcome to Aging Revolution. My name is Ty Mines. Today I am joined with Randy Rodgers from Java's Insurance Counseling Department. Randy, what can you tell us about yourself?
No, thanks for having me on. I've been here at Java for 10 years now, running the insurance counseling program. I've learned a lot over the years and somehow have stumbled into being a subject matter expert on this. And so I feel like I'm able to help people every day when I come to work, and the people that are part of our department feel that way too. So we're very excited about what we do.
So, our first question today is a pretty broad one, but I think a pretty good place to start. What is Medicare?
Well, Medicare is a national health insurance program. It's for people who have aged in 65 or older, or who maybe have been on a disability for 24 months. And the 25th month, they go on to it. And there's some other little caveats, but it's a national health insurance program. Um, People sometimes get that confused with Medicaid, which is a state health insurance program for people who are low income. I don't know why they named them very similar. Does get confused sometimes. And you do have people who are on Medicare as their primary health insurance and Medicaid as their secondary. So you could have both. So
And you talked a little bit about the eligibility. You have to be above 65 or have a disability in 25 months. Is there any other eligibility requirements that people might not know about?
um, there are very specific things when it comes to a kidney transplant or ALS or so. Those people will end up on Medicare also. But the biggest thing is people sometimes get confused. They hear about that if I don't enroll when I'm supposed to enroll, there's going to be a penalty. And if you are turning 65 and you're continuing to work and you're getting your health insurance through your employer, it doesn't necessarily mean that you need to pick up all the pieces of Medicare. It'll depend very much on the specifics of where you work and the type of insurance you have. But we have many people in our area who will work, 2, 3, 4, 10 years past turning 65 and are perfectly fine not being on Medicare because they're using their employer health insurance. So that does get confusing sometimes for people. They get a little apprehensive thinking, oh, what am I supposed to enroll for? I'm turning 65. So what we've learned is nobody is cookie cutter. And if somebody answers a question very quickly for you, it says, oh, should I go into Medicare? And they don't ask any follow up questions, they just give you an answer. Don't listen to that because it's very specific to your unique situation about what path you should be taking.
There is a process called open enrollment. Can you talk a little bit about what that is and how that looks for people?
Yeah, and this is where it gets confusing. Medicare has about a half dozen enrollment periods. Some of them are very specific to you and your age and where you are in life, whether that be your initial enrollment or special enrollment or something. That has to do with when you're signing up for Medicare. Once you're on Medicare, um, open enrollment happens every fall. It's between October 15th and December 7th, and it has to do with specific parts of your Medicare, not the whole thing. So it has to do with if you're on original Medicare and you have a prescription plan, open enrollment has to do with prescription plans. Or if you're on a Medicare Advantage plan, then it's about your Medicare Advantage plan. So it's a very specific subset of Medicare, but it's a very important uh, enrollment period to not overlook.
And that's probably our busiest time for insurance counseling, wouldn't you say?
Yes, we see probably 2/3 of all of our clients in the 7 weeks of open enrollment in the year. Last year, we saw 2,937 clients in 7 weeks, so that's, quite a bit. It's very busy.
It's a lot of people.
Yeah.
Can you talk a little bit about what Medicare Part D is and why it's important for people to review that every year during open enrollment?
Sure. Well, those are sort of two questions. Medicare Part D is the prescription part of Medicare. It came in later. Used to be years ago that Medicare didn't have any prescription insurance coverage, but now it does, and it's been um, in a process of change over the last few years. Some very important improvements on it, which is very good for beneficiaries. It helped making prescriptions more affordable, and that's something you see in the news a lot. So there were some very good rules put into place uh, back, s- 6 years ago or so, and they're now phasing in. So that's very important. But then you asked about open enrollment, and here is what you get to do in open enrollment and why it's important. One is you get to look at what your options are for the next calendar year. Why that's important is that on January 1, every insurance plan you would have for prescriptions in Medicare changes everything about it. How much the premiums are, what drugs are covered and which ones are not, and how much each drug is at each pharmacy. All that's up for grabs. That will change. People will say to me all the time, I like my plan this year. I'm just going to keep it for next year. And I go, well, that really isn't an option. You're going to get next year's version of your plan, which may or may not work for you. So during open enrollment, you get to look at all the plans, see if what's the plan that's going to be the best to meet your needs. And then you can, if you need to change, you can change. About 50, well, not about, exactly 50% of the people who come and see us, next year's version of their plan is perfectly fine. Uh, it's going to be better than any of the others. So we don't do anything. We let it ride. They leave the appointment with peace of mind, knowing they had the best plan possible. But 50% of people, next year's version of their plan is not going to work the best for them. So they will need to change plans with the help of one of our counselors. And by doing that, they will end up saving money on premiums and picking up their prescriptions uh, for that next year from what they would have been paying. And we kind of do a little game. We say, well, this is how much, if you didn't come in, next year's version would cost you. And here's how much it's going to cost you now that we've changed that, subtract one from the other, and you get the amount of money that we've saved somebody. Well, last year's open enrollment, that total amount of savings was a little over $4 million on their prescriptions. So it's very important. Um, Financially, obviously, that's a lot of cash back in people's pockets that they would have had to spend. But also, we know that if you can't afford your prescriptions, you won't take your prescriptions. And now it's a health issue. And so that's very important also. So, open enrollment is a very important time for Medicare beneficiaries. Fortunate is the majority of beneficiaries don't know about it or don't bother doing anything in open enrollment because they think they're perfectly fine with what they have. So they don't check, and they could find out. They could get a rude awakening the next year. January, February, we get calls all the time from people standing at their pharmacy going, hey, this prescription I was getting last year for $5 a month is now $100 a month. What happened? And it's like, well, your plan changed and you didn't do anything about it. So, uh, and there's nothing we could do about it at that point. It had to be taken care of during the open enroll. Yeah. So, sorry, that was very long winded on the explanation, but it's one of those things that we're so deeply involved with. We've got Medicare counselors. They're all volunteers. They're all passionate about what they do. We have this last year, we had 50 volunteer counselors who were able to help people through this process. And they wouldn't do it if they didn't think it was important.
And many of them have gone through insurance counseling themselves by the time that they're volunteers, isn't there?
That's right. Most of our volunteers started out as clients. So,
It's a nice symbiotic system you have going down in insurance counseling.
yes. we got another, say, about 30 volunteer support staff doing various roles that aren't counselors. I suppose I should step back and kind of talk about the program as a whole. Um, so we call it insurance counseling here at Java. It's part of a national program, a federal program called SHIP, State Health Insurance and Assistance Program. And that's to provide boots on the ground to help people understand Medicare, get answers from Medicare, help with the processes with Medicare. And those people are there with unbiased advice. They're not trying to sell anything. There are plenty of people out there who would be glad to talk with you about Medicare who are trying to make a dollar on what your choices are in Medicare. And, you know, in our area, I know lots of insurance salespeople and brokers who are there for the community, who do a great job, who really try to help find the best situation for people. But unfortunately, there's also some bad actors who want to take advantage of Medicare beneficiaries to make the most amount of money for them. And we have seen where uh, people end up with plans and then find out, drugs aren't covered, doctors aren't covered, hospitals aren't covered under that plan that are ones they normally use. They just got talked into this by a salesperson who's trying to make some money.
Yeah.
So,
Um, our new marketing kind of tagline for insurance counseling has been skip the sales pitch, skip the facts, because that's just what you guys do down there.
yeah.
No one's trying to sell you anything. They're just trying to help you figure out what is best for you as an individual.
Yeah, absolutely, absolutely. I appreciate that tagline. I've used that quite often this summer. Um, hey, if you think about it, your counselors are volunteers. We've trained them, they're highly trained. They are certified to do this counseling through the SHIP program. And that SHIP program comes down to the state level of VICAP, Virginia Insurance Counseling and Assistance Program. And so they all have to take certification tests through that. They have to be run through the Bureau of Insurance in Virginia to make sure they don't have a connection with an insurance company. They don't hold a license to sell insurance. Um, because we want to be here to give you that unbiased advice and counseling. Uh, and we think that's very important to do that. I kind of laugh. People come to us and they're so pleased with the service that they get. They feel much more relaxed because they have the answers, a weight's taken off of them, and we do surveys, satisfaction surveys, and we get a 99% positive feedback on those surveys, um, and year after year. And it just means that in the community, we're here, we're well respected to being able to help people through this process in a very knowledgeable but very um, serving way. These volunteers, as I said, wouldn't be doing this if they didn't feel like they were helping the community and that it was important what they were doing. A new counselor just learning how to do open enrollment, just a slice of the Medicare pie, goes through 15 hours of training before they ever see a client. Uh, and that's dedication. They really want to do this. Um, so so we love our volunteers. We could not help the number of people. We could not help them with the quality and quantity that we're able to do without all these volunteers.
Definitely. I think one of the things that you talk about the volunteers I've always kind of liked is that you say, a volunteer is truly knowledgeable about insurance counseling and open enrollment when they know what answers they don't know instead of thinking that they know the answers. When they're able to say, actually, I have no idea. Let me go find out, is when they are truly fully knowledgeable about open enrollment because insurance counseling is just so complex and it changes so much that there's just so many things to keep track of all the time for
It is. It is.
every year, basically.
And one of our mottos for our counselors is you're never alone. You always have somebody there that's got your back to help answer those questions. To even just I want to get a second opinion, make sure I'm right on this. And I have a new volunteers coming in this fall, and I was asking him about, why he was choosing to do this. And he said, I was in for open enrollment and I watched that. I watched how your counselors were knowledgeable, but they wanted to make sure they got it right. And so they were checking with other counselors and things. And I thought, wow, the support that they have with each other to be able to verify that they got the right answers. He goes, I want to be a part of that. Yeah. So
It's great. So we talked about it a decent bit um, in the previous questions, but why is Medicare such a complex system for people to navigate? Why is it so difficult for people to figure out what claim works best for them at home? And why I know I'm asking you all I want to,
no.
but why do people choose to come to job as insurance counseling for help during that?
Well, first of all, you asked about the complication of the system, and any time that you have a system that's been built up through bureaucracy over decades, uh, the complexity of it just keeps rolling on itself. And it's a Medicare is a combination of the federal health insurance and then pieces of it that are done by private insurance companies. And so that partnership helps to make it even more complicated. Um, so it it is a it is a very intense system to navigate for that. The second one is you ask why people have trouble with this. Well, most of their working life, they've had an HR department or a benefits manager or somebody going through all of this, processes and figuring things out and then telling you what your options are and explaining your options to you. When you retire and go on Medicare, you're your own benefits manager. You have no education or experience in this at all. So it is by that nature going to be complicated that you're now having to figure out this insurance without the help of somebody at your company. So that's partially why we uh, do all the stuff we do. If you think about it, we help people with new to Medicare when they're first starting out, or they're turning 65 and they got questions they may or may not need to go on to Medicare. Then you got people who have trouble with their Medicare. They're trying to figure out something. They got questions about their Medicare. And we're there to help them sort that out and get them answers and point them in the right direction. And then there's open enrollment where we help people every year, which we've talked about in detail. I still think, though, open enrollment is very big, very important, and there's nice shiny numbers of almost 3,000 people and $4 million and all this. I think helping people set their Medicare up in the first place in a way that is going to benefit them uh, is the most important thing that we do. Uh, because what's right for one person is not right for the other next person. Um, there are lots of questions to be answered, and everybody's situation is slightly different. And so that's why our counselors go through so much training. And then year-round counselors who are doing this, they have to shadow counselors for like 6 months before they ever start taking on clients on their own. And even then they still have the support of it because each person's different. And uh, to add to the complexity of Medicare, state rules and laws go into the mix of that. So, how Medicare plays out, how much it costs, what options people have, and which ones are the good options depend on what state you live in, or even what zip code it gets down to. So when someone calls us and says, "Oh, I'm moving to North Carolina," I said, "Let me get my counterpart for you in North Carolina because North Carolina is going to have different lay of the land when it comes to Medicare." And we get calls all the time. "Oh, I'm in Florida. I'm moving to Virginia. Great. Let's talk about what you need to change for your Medicare moving here." Because it's, even though it's a national health insurance program, it plays out different zip code to zip code. And so makes it even more complicated. I tell people, I said, "Don't listen to your cousin in New Jersey. They don't live here."
Yeah.
So
I do have a question regarding that. You're talking about people moving across state lines. If you are to move, does that mean you can't get a new insurance until open enrollment starts, or can you just change when you
that's one of those special enrollee periods. When you move and your current setup on your Medicare won't move with you, you get 63 days to make changes to your Medicare. Um, so and that's great. And we help a lot of people do that. Sometimes, unfortunately, we get people to come and go, "Oh yeah, I moved here 4 months ago. Should I change something about my Medicare?" And we're like, "Oh yes, but oh, you can't do that now." And there's some of those there's some ways where that becomes, a permanent problem. Because when you have windows of opportunity to change, it might mean that after that window's closed, you can't change it. So, uh, but again, the rules are very complicated. So
We've also kind of discussed this little bit, but what are some of the biggest misconceptions you tend to hear about Medicare, either when people are coming to you from insurance counseling or just generally out on the street?
the biggest ones that some I've mentioned is people think, "Oh, I'm turning 65, I have to go on Medicare." Well, that may or may not be true depending on your situation with work. And even saying that, you could be working and continuing on insurance, but the particulars about your company and that insurance may mean that you do or don't need to activate parts of Medicare. So it gets very in the weeds about that. But I think that misconception is that I have to start Medicare when I turn 65. That one is one of the biggest ones. And the other one has to do with, there's a lot of advertising to get people to choose particular paths in Medicare on their insurance, and that really has ramped up in the last 3 years in Virginia, and so there's a lot of misinformation out there, and people are making, uneducated or bad decisions, uh, because they don't have all the information, and they're getting a very biased, presentation about what they should be doing with their Medicare. Um, and so, I think that's become a major problem. And when I meet with my colleagues around the state, that comes up every time. In fact, so we refer to some of that advertising, whether it be on TV or phone calls you get or emails you get or things like that. We refer to it as predatory advertising. And so that heightens the misconception about what you should do with Medicare.
Oh, for sure. Can you kind of go over the difference between Medicare Advantage and Medicare Gap or supplement plan?
True, true. In very basic terms, there's two paths that you could choose Medicare. You could choose to have what's called original Medicare, where you have your A and B card as your primary insurance. They're paying 80% of the bills. Then you have a Medigap policy, known as a Medicare supplement policy, and it's picking up the other 20% of the medical bills. And your cost for doctors and tests and surgeries and therapy and all that is limited to a very small amount, for most cases, $257 for the year. So that's great. And then you add a Part D plan to original Medicare for your prescriptions. A Medicare Advantage plan is you take all the pieces of Medicare, you hand it over to a private insurance company to manage your health care. So now the insurance company is heavily involved in medical decisions about your treatment and what the doctor can or cannot do. Uh, and Medicare Advantage plans are wildly different across the United States. There are some places that have great Medicare Advantage plans and they work really well when you try to use them. And there's other parts of the country that their plans are not as good and there are problems when you try to use them. Virginia is in that second half. I get a lot of people who would tell me on the Medicare Advantage plan that, oh, they like their insurance until they tried to use it. And that's not good. That's not a good situation. It's obvious it's cheaper to be on a Medicare Advantage plan than have all the pieces to original Medicare, but there's uncertainty with your with the care you may get or what gets approved to do that. Virginia has a pretty high rate of denials for pre-authorization, and it's usually on the important things and the expensive things. Uh, so people can find themselves in a situation where their insurance is not going to cover what they need. Uh, that's the vast difference between the two. I always tell a scenario on original Medicare. If it's Saturday night and your left arm has gone numb and your chest is hurting, calling the ambulance, going down to the emergency room, them running a battery test on you. They wheel you upstairs for 2 days to figure out what they're going to do. Then they have surgery. Excuse me. And then you go to rehab or a place to convalesce for a week before you go home. And then you got 6 months of physical therapy. For people on original Medicare, that most likely that whole thing will cost you $257 for the year. And that's if you haven't already met that deductible. It could be absolutely free. And I know plenty of people have had significant medical services done and for almost no bill whatsoever on original Medicare. So when it's Saturday night and you're thinking about whether to call the ambulance or not, on original Medicare, it's really not a financial decision. It's just a health decision. When you're on a Medicare Advantage plan, that becomes, again, a financial decision. And it's very similar to insurance that I would have in myself at work or so. And I know if I, have something going on and I'm thinking about going to the emergency room, I'm calling the health professionals in my life first to go, what do you think? Because I know just walking in the door is going to cost me a few $1,000s just to walk in the doors of the emergency room. And that's just the way the insurance is. Uh, but if you're on original Medicare, and now you're older or so maybe, and health problems are coming around. Healthcare decisions are not financial decisions in the same way, and I think that's a good thing.
Mm, that's a very good thing, yeah. What advice would you give Medicare recipients during open enrollment or for those helping their loved one during open enrollment?
Ah, I mean, that sounds biased, but I would set up an appointment with one of our counselors or a counselor in the area you live in or so, and walk through your options. Figure out, get an education on here's the options. What do you want to do? As I said before, you got a 50-50 shot, 50% chance that the plan you're on next year's version is perfectly fine for you, and a 50% chance that it's not, and it could be really not. Uh, and then changing to a different plan would save you money and make prescriptions easier to get. So I think that I think it's vastly important to check that. I would be careful uh, about checking that through someone who's trying to make money off of you because you don't know. And I know that we get calls from insurance agents in town saying, "Hey, look, none of our products are going to work well for them. Can we send them over to you?" And I think that's a testament to them looking out for the people that are in their community, that they're their clients or so. So open enrollment is too important not to sit down with somebody who's going to give you an unbiased evaluation of your options.
What is one thing you wish everyone understood about Medicare and open enrollment?
Well, I mean, it really is a base level thing. I mentioned there's a large number of Medicare beneficiaries who are unaware of what open enrollment is and the importance of it, or who don't bother to check because they think that they're fine. I had a gentleman when I first started here 10 years ago. He goes, I don't know why my wife sent me in here. I've had the same plan for years. And I go, well, it probably has bit you. You just didn't realize it bit you. And you're probably paying too much now at this point for your prescriptions and your plan. And I think that's some I wish everybody knew that you do need to look at this during open enrollment because, as I said, with less than 3,000 people, we saved them over $4 million. Uh, that's that's a lot of dollars back into people's pockets who are most likely on a fixed income. And really, when you're talking about that amount of money, as I said, they're going to go. My medication's too expensive, and so I can't. We're just not going to take it. I had a lady several years ago, and we got done putting her medications into the Medicare.gov website. And I said, "Well, is there any other medications that you take? We want to make sure we get the right list." And she goes, "Well, I was supposed to take this gout medication, but it's too expensive, so I don't take it." I went, "Well, let's put it in." And we put it in, and we came up with a number, and I said, "Well, is that affordable for you?" And she's like, "Oh, yeah, I would take it then." It was like, so she wasn't taking a medication because she had a perception that there wasn't an insurance that would cover it well for her when there really was.
Yeah.
So,
I feel like that would be something that is very easy to miss if you especially if you've spent your entire life working with a insurance company in your own job because we don't really have a lot of say, I guess. You don't get to say in if you are working, if you're going through HR and doing all of that. You kind of just get what you were given.
yeah.
So it would definitely be a pretty jarring change to turn 65 and be retired and suddenly, oh, I get to make my own decisions on what path I want to follow and what works best for me.
Yeah, and you've got a lot of options, and what's the right options for you is not necessarily the right options for the next person, but, you know, there it people really do. They walk out of those appointments, whether open enrollment or new to Medicare or so, and you just see a weight lifted off of them because they now have the answers. Uh, and oftentimes people come in and I got 2 questions about Medicare, and they leave realizing there were 5 questions they didn't know to even ask. And now they got the answers to all of them, and then they know what to do at that point. And yeah, I think it's a very good feeling as a counselor to know that you have helped people through a complicated process, and now they feel, as I said, they get the weight off of of that, and they feel like, okay, I can make an educated decision now, and I can. Uh, and oftentimes, I've had people who didn't understand their Medicare, and once we've explained how it works to them, I had a lady recently who said, "Oh, if I knew that, I would have gotten this health problem taken care of," because she didn't understand how her insurance worked. I was like, "Oh my gosh, that is gonna make a huge difference in her life." Because now she could turn around and go to the doctor and say, "Hey, what can we do about this? Because now I know my insurance will actually cover it." But she was under the perception that it would just be too expensive to have anything done about it.
Yeah. I think that really gets into the core of why insurance counseling is so important and why we value it as a program so heavily at Java.
Yeah. I appreciate it. Java has supported this program, uh, and there's plenty of donors and grants that we get for this program because people in the community outside of Java see the value in it and want to support it. Make sure that we've got the financial resources to continue to do this and to grow and to expand. When we started this, uh, last came on 10 years ago, we saw what, maybe it at a good year, 1,500 people in a year. We see 5,000 in a year now, and that's growth has been one because of all the volunteers on board. And that's the most important. And then the other one is it's just people in the community, whether Java or people out in the community said, we see a value in this and we want to support this. I will have to say another shout out while I'm thinking about that change and that growth in there. It comes to our volunteers. We treat our volunteers like the smart, intelligent people they are with the life experiences that they come and bring with them. And so when they come up with ideas, we listen. Most of the major improvements we have made in this program, maybe minor improvements we've made in this program, started as a volunteer with an idea. And I find my job is to figure out how to say yes. It's like not like, oh, we don't do it that way, so we can't. It's like let's figure out how to say yes to that. That's a good idea. What do we need to do to make that happen? And so we've done major improvements over the years. We've won awards at regional and national level for innovation because of ideas of our volunteers.
Yeah. Volunteers are definitely very talented people. I mean, all of Joppa's volunteers are, but
Oh yeah.
insurance counseling, it's just there's a special level of dedication required to sit down and say, "Yeah, I wanna be a volunteer for insurance counseling."
Yeah, and as we have expanded, we have not only counselors, we have admin assistants, Zoom hosts that help with our Zoom. We have receptionists, and we're now starting a new role where people out in the counties at Java sites are helping people get onto Zoom with a counselor who may not have the technology or the technical knowledge on how to do a Zoom. So we have these, we're calling Zoom assistants, and they're brand new. We've got several of them going to be starting for open enrollment that will just make sure someone out, way out in Cali, maybe 45 minutes away, doesn't have to drive all the way in to see a counselor. They can get assistance by one of our volunteers helping them get onto Zoom at one of the Java sites.
Yeah, which is incredibly important if you think about how transportation can be such a barrier for especially people living out rural communities.
Yeah.
Yeah. Yeah. Is there anything else that you would like to share before we end off today? Any final notes?
Wow, we've talked about a lot of things here. There are new rules coming into effect with prescription insurances, as I mentioned earlier, that are improving the situation of people with prescriptions, and every year there will be new ones, and that will affect your choices when it comes during open enrollment. But there are some new rules having to do with your ability to maybe to make a change with your Medicare supplement plan, your Medigap policy, a new rule in Virginia that went in effect on July 1. So if you've got questions or so, it's just good to give us a call, and then our admins will know whether that's a quick answer or whether that's a, hey, let's get you an appointment with a counselor or so. And it just, we're here to help. I tell this every time I'm out speaking in the community. The biggest thing I want you to know is we are here to help you. When you have questions, when it comes that time of year for open enrollment for you, uh, we're here to help. Don't feel like you're on your own with this.
Definitely. Well, if you're wanting to set up an appointment for Medicare counseling, or if you are looking to make some changes to your plans this open enrollment, which we highly advise that you at least look at it to make sure that it's going to work the best for you, you can call the insurance counseling office at 434-817-5248, or you can fill out the form on our website, which will be linked in the description below. That is all for this time. Thanks for listening. We'll see you again next time.